Thank you for tuning in to UroChannel, where I'm about to talk about a small implant that can have such a great impact upon your quality of life. I am talking about the testicular prosthesis. Who needs it? What advantages can you expect? And what are the risks involved? My name is Stefan Buntrock. I'm a urologist and sexologist. And if you never came across my channel, I advise you to go on my channel homepage. Watch some of the videos from my playlists on urological conditions and sexual health and get an impression of what content I put out on YouTube. 90% of you who are watching my videos haven't subscribed. So as a sign of appreciation for the many hours I spend every week making videos with reliable medical information for you, I would very much appreciate if you became a subscriber. Click on the icon on the right-hand corner, like this video, and activate the bell. Now let's get to the point. A testicular prosthesis is a testicle-shaped replacement made from silicone filled with saline. They come in different sizes, so a match for the size of the testicle still in place is easily found. So when it comes to the question who needs a testicular prosthesis, the answer is not that easy, because strictly speaking, you don't need one, as you are going to do fine without one as well. However, everybody should at least be offered one and be given the chance to think it through if one testicle must be removed due to testicular torsion, cancer, trauma, or undescended testis. Because even though you could lead a happy life without suffering from any physical limitations, I uploaded a video about it, by the way, there might be psychological issues when there is only one testicle. Research shows that loss of one testicle may cause an identity-altering crisis in some men. 17% of long-term cancer survivors of testicular cancer report a change in body image. Here's where a testicular prosthesis can be of help. More than half of the patients report an improved body image after prosthesis placement. When in place, a prosthesis looks completely natural. The only way one would be able to tell it is a prosthesis is by actually touching it. This is one of the traps one might fall into as a doctor. I remember one patient way back when I still was a resident. I was on call one night and he showed up at the emergency ward for some problem, I don't remember. Anyway, he had a testicular prosthesis and he didn't bother to tell me. So when I examined him, I immediately thought he had testicular cancer because one testicle felt hard like a rock. But lucky for me, I didn't vocalize my thoughts but soon became suspicious as the surface was very even and smooth. So then I asked him whether he had a prosthesis, which he approved. Silicone prostheses nowadays are incredibly durable. I recently watched one episode of Botched, where Dr. Nassif and Dr. Dubrow put a breast implant to the test. They smashed it against walls, stepped on it, and even ran over it with Dr. Nassif's sports car. The implant survived all attacks without any problems. So you shouldn't bother about the durability of a testicular implant. You can pursue any activity you like with it, no problem. It is comfortable to wear and you will stop thinking about it after a while. What about surgical complications? Naturally, all surgical procedures have their specific complication rates, and testicular prosthesis placement is no exception. By the way, this may be performed at the time the testicle is removed or later. Just generally, major complications are quite rare. We are talking about the implant starting to migrate or to be pushed out. This happens in about 2%. The lowest overall complication rate is reported from patients with testicular cancer with 11%, and the highest after testicular removal due to infection with 31%. Most of this is minor stuff like postoperative pain. The risk of infection is low, with approximately 3%, but this depends on the underlying disease. Overall, testicular prosthesis placement is a minor and safe procedure. Most patients are satisfied with the result. However, there are also complaints. Numerous studies have shown that a third of the patients are unhappy with the size of the implant, while a significant number don't like the firmness of it. About 1/4 to 1/3 think that the implant has been positioned too high in the scrotum. If you consider a testicular prosthesis, I recommend that you undergo the procedure at a place where they sit down with you and give you thorough information about all pros and cons so that you can make an informed decision. Because that's the foundation for a satisfactory outcome. Thanks for watching. Bye-bye.